I feel angry and irritable all the time. I snap at people at work and yell at my family.
When I lost my job, I felt useless. I couldn't get along. I began to drink every night and sleep, just sleep all the time.
I can't concentrate at work. I start something and I lose my motivation, and I don't get anything done.
My wife died over a year ago, and I feel really terrible. I just can't get on with my life.
Hello, my name is Maja Jackson Trish. Do any of these feelings sound familiar to you? From time to time throughout our daily lives, we all experience feelings of sadness and feeling a little down. These feelings may be caused by job problems, relationship problems, even something significant like the loss of a loved one. At other times, we may experience these feelings and can't pinpoint how they started. Even good things can cause us to feel a little down. Sometimes it's surprising, but good things like the birth of a child, a job promotion, can also cause us to feel a little edgy, a little anxious, a little blue. We may begin feeling better after spending time with friends, hearing some good news, even seeing a good movie. These feelings may in fact be only temporary and last only a short time. However, if these feelings don't go away, if you feel sad, blue, depressed for days on end, even weeks or months, you may have a medical illness called clinical depression. Clinical depression is a medical illness that affects your whole body. It affects your body, your thoughts, your mood, and your behavior. In clinical depression, the bad feelings, the thoughts of feeling very sad, very depressed, downhearted, blue, hopeless about the future, these feelings don't go away. They're there nearly all the time, day in and day out.
I don't want to get out of bed in the morning. I don't feel like eating. Nothing interests me. Not even spending time with the kids.
In clinical depression, things that used to be enjoyable are no longer enjoyable. Things that used to be very appealing and fun are no longer fun. People may lose interest in basic daily activities like eating and sleeping. They may even lose interest in sex. If not treated, clinical depression may seriously affect your life and the lives of your loved ones. It may even have a serious impact on your ability to work. Whether you have just a temporary mood change or a clinical depression, your doctor understands the connection between your emotional, physical, and mental health. Your doctor can help you sort through these feelings and help you take the next step to getting better. Clinical depression is a highly treatable medical illness, so learn the symptoms and talk with your doctor. There are many symptoms associated with clinical depression, and depression may not affect everyone the same way.
I feel terrible about myself. I ate the whole bag of cookies, and I didn't even care. I feel so guilty about it.
Some people find themselves eating a lot, sleeping a lot more than usual, while others lose their appetites and have a lot of trouble falling asleep and staying asleep.
I don't have any energy. I can't take care of my job, my family. I don't know who I can go to. I'm afraid people will think I'm weak or lazy. I don't know. I don't know who I can go to.
Here is a list of some of the symptoms that may signal clinical depression. Clinical depression may be present if you have any or several of these symptoms. Persistent feelings of sadness or emptiness.
I used to love music. Now I've lost all interest in it. I used to carry my CDs with me all the time. Now I don't even want to see them. I'm so confused I don't know what's going on.
Loss of interest in things that used to be enjoyable, like sex, sports, reading, listening to music, or other hobbies. Trouble concentrating, thinking, remembering, or making decisions. Problems sleeping or sleeping too much.
I just don't have any energy anymore. I try to get up, I try to go to work, and I just can't get out of bed. I know I have to do that. I know I have to go to work. But when I'm there, I just know people think I'm weak and I'm lazy. I just don't know what to do any longer.
Lack of energy or feeling overly fatigued. Loss of appetite or eating too much. Losing weight or gaining weight without trying. Crying a lot. Feeling irritable or edgy.
I feel so useless and worthless. I lost my job and I think it's my fault. I've started drinking more lately and I don't know what to do about it.
Feeling worthless or guilty. Feeling hopeless, pessimistic about your future. Thinking of death or suicide.
My body hurts and it's achy all the time. I can't concentrate. I just don't feel right.
Frequent body aches and pains or bowel problems that don't get better with treatment. Clinical depression may be mild, moderate, or severe. Some people may experience very intense symptoms for a few days or a few weeks, while others may experience less severe symptoms, but over a longer period of time, like months or years.
I feel so empty and miserable. I just want to die. I feel the world would be better off if I wasn't here.
People with severe depression may find it very hard to get out of bed or care for themselves. They may even start thinking a lot about death. They may even have a wish to die. But whatever the severity or intensity of depression, it's an illness that makes it difficult to carry out everyday activities and responsibilities. Effective treatment is the key to getting energy back and the key to getting hope back. Scientists have studied depression for many years and have concluded that a combination of factors cause depression. We can use this scale to illustrate. Let's imagine that life is like this scale. When things are going well and we're feeling good, we could say that life is in balance. And you can see the scale, now empty, is in balance. The factors that can cause depression fall into 5 major categories. These are: number 1, biochemical. Researchers have discovered that depression is associated with changes in the chemistry of the brain. These chemicals are called neurotransmitters. Scientists have found that in depression, these chemicals, these neurotransmitters, are not present in the brain in the right amounts. There is a chemical imbalance. This imbalance causes physical and emotional changes. Number 2, psychosocial. Stressful experiences are among the most common reasons that people become depressed. Many things can cause severe stress. Some examples are the death of a loved one, a separation or divorce, or other relationship problems, job stress, financial stress, feelings of loneliness or isolation, moving, or a child leaving the home. Feeling like you're not living up to your expectations of yourself or others' expectations of you can cause severe stress. Or if you have a history of verbal, physical, or sexual abuse, or if you have experienced any kind of severe trauma, you may be at greater risk for depression. Number 3, physical. Natural changes in the body, seasonal changes in the climate, and lifestyle habits can cause symptoms of depression in some people. For example, some women experience depression associated with their menstrual cycle, the recent birth of a child, or menopause. Some people may be sensitive to the change in seasons and may become more depressed as winter nears. Alcohol and other drugs are depressants, and also when used in excess may cause depression. Number 4, hereditary. Researchers have discovered that clinical depression tends to run in families. So if you have a relative who has suffered from depression, you may also experience depression. Remember, not everyone who has a close relative who experiences depression gets depressed. If you have any questions about this, talk to your doctor. Number 5, medical. Certain physical illnesses can cause depression. Thyroid problems, stroke, cancer, brain tumor. These are some medical illnesses that can cause depression. Some prescription medications, such as steroids, oral contraceptives, which are birth control pills, and certain blood pressure medications can also cause depression. If you think your symptoms of depression are caused by your medical condition or your medications, consult your doctor. Depression is not a personal weakness, a personality flaw, or laziness. Don't blame yourself for feeling depressed or experiencing any of the symptoms of depression. Depression is a medical illness, and it's a highly treatable medical illness. Although some people may recover naturally from depression, others may experience symptoms for months, even years. Clinical depression may be acute, meaning that it lasts only a few days to weeks, or it may be chronic, meaning it can last for years. How long depression lasts depends on the severity of symptoms, whether and when someone seeks treatment, and personal factors. Research has shown that appropriate treatment can dramatically speed recovery. Also, people who have received treatment are a lot less likely to become clinically depressed in the future. The idea that you may need to get help for depression may be hard to think about, especially if you're feeling hopeless. The idea that you may need to get professional help may seem embarrassing to you. Some people think that drinking alcohol, taking street drugs, or tranquilizers will help them feel better. In fact, these things make the depression much worse. Other things may keep you from getting the help you need. For example, friends or family may tell you that you should be able to just get yourself together or snap out of it. Remember, clinical depression is a medical illness, and like other medical illnesses, is not fully within your control. Getting the appropriate help is the key to getting better. There are several ways of treating clinical depression. Depression may be successfully treated with psychotherapy, with medications, or a combination of both. Both psychotherapy and medications can return a depressed person to normal physical and emotional functioning. The type of treatment recommended by your doctor depends on the type of symptoms, the severity of symptoms, and personal preferences. Together, you and your doctor can choose the treatment best suited to your symptoms and to your lifestyle. The process of feeling better usually takes just a few weeks. Although full recovery from clinical depression may take a few months, you can take heart in the fact that full recovery is the usual outcome of treatment. Psychotherapy is one method used to treat depression. Used alone, psychotherapy is most successful in mild to moderate depression. When used with medications, psychotherapy is also quite successful for severe depression. If you and your doctor choose psychotherapy, you will be referred to a trained psychotherapist who will help you find ways to understand your problems and help you develop techniques to work through your problems. You and your psychotherapist will work together to solve whatever difficulties you may be having.
Maybe a six-pack a night.
Every night?
Well, not every night, but a lot of times when I come home from work.
Do you, how old were you when you started?
I was 16, 15.
You may work with a therapist alone, in a group with other people who are experiencing symptoms like yours, or the therapist may also want to include a loved one in your sessions. In psychotherapy, you'll learn how to change behaviors that make your depression worse. Learn how to change negative beliefs and thought patterns and develop a more positive outlook. In psychotherapy, you'll also learn how to improve your relationships and incorporate more positive activities into your daily life. Psychotherapy may begin working right away, or it may take a few weeks to show beneficial effects. But psychotherapy has no physical side effects. Antidepressant medications can also be used to treat clinical depression. These medications are especially necessary in severe depression, but are also used to treat mild and moderate depression. Antidepressants help balance the chemicals in the brain. Antidepressant medications improve your sleep, raise your energy level, and help your appetite return to normal. It may take a few weeks for you to feel better, however. Your symptoms, your medical history, even your family history will give your doctor important clues about the medication that's most appropriate for you. Your doctor will work with you on choosing the medication that works best and has the fewest side effects. Antidepressant medications are not addictive, and your body will usually adjust to any side effects you may be experiencing in a week or two. If not, your doctor will work with you on changing you to the medication that makes you feel the most comfortable. Now let's return to our scale. Just as I said earlier that there were several factors that can cause depression, there are also several keys to getting better, to getting your life back in balance. These keys are, number one, awareness. Become aware. Learn as much as you can about depression. Read booklets like the one provided for you with this video. Talk to your doctor about your symptoms. Number 2, acceptance. Accept that depression is a treatable medical illness. Don't blame yourself for any symptoms you may have. Number 3, action. Take action. Go see your doctor. Find out whether your symptoms mean that you have clinical depression. Number 4, asking questions. Make sure that you ask your doctor any questions you may have about depression and any questions you may have about how depression is treated. Number 5, adherence. When you and your doctor settle on a course of treatment, make sure you follow through with the recommendations and keep your appointments. How are you doing?
I really feel a lot better since I've been coming here.
Oh, great. How are your family? How are things going?
My family, they've noticed a difference. They think I'm much better. They feel that I'm happier.
That's good.
Yeah, I'm very happy that I came.
Good.